All right, welcome everybody. This is day 23 of the 20 and 30 challenge. And today's topic is a little bit different angle than what you guys have been getting so far. You know, we've been talking a lot about nutrition and supplements and exercise and planning. And I want to talk to you about taking care of your spine this morning. And the reason why is because your spine and nerve system run and regulate every single function in your body. And so I know that for this 30 days, people are really focused on losing weight and eating better, and that's where the majority of your attention has gone, and that's all great stuff. You know, my family and I, we work really hard to eat well, and we exercise, and we take the highest quality supplements, and we make sure and get toxins out of our body and minimize our exposure to those things. And those are all great things, but at the end of the day, if you look at the human body, you know, we know that the brain is what runs and controls everything, even hormone balance, weight loss, and ultimately optimal health. And so I just want to throw this in there, partly because I'm a chiropractor and I'm passionate about what I do, but I'm also throwing this in there because I'm a student of anatomy and I'm a student of physiology, and I want the absolute best health for myself and for my family. And so I'd be remiss to leave this part out. And I also think that it's one of the most overlooked factors in terms of health. And you know, I can't tell you how many times people come to me and say, you know, I'm super healthy, or I'm making all these positive changes, even if it's when they're learning from my workshops or my emails or my content. It's still, you know, if you're leaving out this one part, not only are you missing a big component of optimal health, but this may just be the key to unlocking your greatest health potential. And the principle goes like this. Our brain sends signals down the spinal cord and then across the nerves, just like electricity wires. And those signals are what tells our heart to beat, and your lungs to breathe, and your stomach to digest food, and for you to blink or wiggle your toes or chew gum. Your brain controls all that stuff. And when there's an interruption in that pathway, which can happen when your spine shifts out of alignment, then we know that not only can that cause back or neck pain or headaches, but more importantly, can lead to serious illness. In fact, there was a study done in the early 1900s by a medical doctor, Dr. Windsor, and these became known as the Windsor autopsies. And he found over a 95% correlation between the ultimate cause of death in people and subluxations or misalignments in their spine. So I'm not going to get too much into that today, but I want you to know that if you're improving every other area of your health, but you're neglecting your spine and nerve system, you're missing out in a big way. And I want to give you one thing to take home with you today. I pay attention to a lot of statistics and trends, and obviously as it pertains to healthcare and just the costs of you know, the burden that's being put on our country and taxpayer dollars. You know, now that I actually have a job and an income, you know, I pay taxes, like hopefully you do too. So I want to see where all that money's going. And the number one cause of bankruptcy in our country is, guess what? Medical bills. And Forbes, I've got this article here. It's actually from Fidelity Investment Consulting, or Fidelity Benefits Consulting, and this was from just a couple of years ago, so it's probably even more by now. But they're predicting now, or not predicting, but their research and statistical analysis shows now that if you're a 65-year-old couple retiring this year, you need $220,000 in the bank, liquid, just to cover medical expenses throughout the years of your retirement. Now listen, that's not $250,000 to play golf in Palm Springs or spoil your grandkids or go on cruises to the Bahamas. This is $250,000 cash that you need just to pay for your sickness and disease. And listen to this, that $220,000 does not include any costs associated with nursing home care and applies only to retirees with traditional Medicare insurance coverage. So that's above and beyond what your insurance would even cover. So this is out-of-pocket costs. And so my point is that, you know, if you want to be average in our country, then that's fine. But you need to be planning and preparing to be average. And what that means is that based on statistical analysis, by the time you're 65, you need a cool $250,000 in cash just to pay for your infirmities during your retirement years. Or you can do what we've chose to do, and what my life mission is all about is to empower and encourage you to pay for your health on the front end. Make investments with your time, energy, and money on the front end so that you don't end up average. I don't want you to be average. I want you to be outside the box, be outside the mold, and I want you to have abundant life and abundant health like I believe I've you know, come closer to over the last decade of working on this for myself. We probably never ever get there 100%, but we're continuing to work on it. And I truly believe that, I'm going to live a long, healthy, happy life until God takes breath out of my lungs, and I'm going to give it my all, and I'm going to work every day at maximizing my potential. There's nothing sadder to me than when you never realize your potential in life. It's like, I kind of picture it like, before you were born, God created you and knew exactly what you were supposed to do with your life. And if we never live up to that, if we never reach that, or we at least don't try our hardest to give everything we have, then I don't think there's anything more tragic. I don't think it's more tragic to lose everything, or to get in a car accident, or lose a loved one. I think that there's nothing more tragic than dying with the music still inside of you. I want to wrap this around full circle, or wrap it up full circle, and just tell you that when you take care of your spine, this is an integral part of being healthy, because it literally is our lifeline. Think about it. The actor Christopher Reeve fell off a horse, jammed his chin into the dirt. The top 2 bones in his neck shifted 1 centimeter into the back of his brainstem, and instantly, not because Christopher Reeve had bad organs, but his whole body shut down. They had to put a pacemaker in his heart, respirator for his lungs, feeding tube through his chest. The nurse had to massage his colon to go to the bathroom into a bag every day. Not because he had bad organs, because he had a bad connection. The brain signals couldn't get from the brain to the body where they needed to go. And so I want to let you know that when you take care of your spine, and many of you are listening to this going, yeah, Dr. Ryan, I've heard you say this 1,000 times. I come and see you for maintenance, and I always will, always have. Great, I'm glad for you, but you need to know that your family members, this applies to them too. Your spouse, if you're doing this but your spouse isn't, guess what? Your retirement funds are probably in the same account. So you need to be thinking bigger picture. Here's what research shows though. Research shows that chiropractic maintenance care patients studied long term, this means they take care of their spine on a weekly basis for 5 years or longer. These are the results compared to otherwise healthy people. Not people that just get adjusted compared to those people in the emergency room or in the hospital, or awaiting a transplant. These are you and I, people that take care of their spines versus otherwise healthy people. When studied long term, these are the benefits where you and I end up compared to where those otherwise healthy people end up, which, keep in mind, those otherwise healthy people, although they may be average, are going to be spending 220 grand on retirement for their medical bills. But listen to this, if you take care of your spine, chiropractic patients spent, on average, 31% of the national average for healthcare. That means you spent almost 70% less. If you want to break that down into a dollar amount, for you and your spouse, you take care of your spine, over the course of a lifetime during retirement years, you get to save $157,000 if you just take care of your spine. This doesn't take into consideration what you eat, how much you exercise, the supplements you take. Should you do those things? Absolutely no question. But first and foremost, you have to have a healthy spine and nerve system. Listen to this. 50% less medical provider visits, meaning you're going to the hospital and the doctor less. Maybe you love to go to the doctor. I don't. I don't want to go there unless I absolutely have to, if I'm gushing blood or I have a heart attack. Their health habits were radically better than overall populations. They had far less cigarette consumption. 98.5% believe their care to be considerably or extremely valuable. Chiropractic wellness patients had 60% fewer hospital admissions. You don't have to go to the hospital as much. 59% less days hospitalized. 62% less outpatient surgeries. 85% less pharmaceutical costs. And that's a big one because, guys, guess what? According to the Journal of American Medical Association, the #1 cause of death in our country every year since 2003 is not heart disease, it's not cancer, it's not diabetes. It's exactly that. Our medical model, our very own medical system, the system that's designed to keep you and I healthy, probably the system that you run to when you're sick, is actually the most dangerous place to go for your health. It's the #1 cause of death. Almost 1 million people die every single year at the hands of medicine. That's not because medical doctors are bad people or nurses don't care about you. My mom is one. She saves people's lives all day long. But taking care of yourself is a way better preventative measure than waiting till you get sick and then throwing a chemical or a toxic chemical in your body, or a surgery removing body parts that were supposed to be there in the first place to get you healthy. I don't want to go off too long, but my point is that when you take care of your lifeline and you allow your body to function and heal normally like it's supposed to, you don't end up like everybody else. And I know for me and my family, I don't want to end up like everybody else. So hopefully that helps you take care of your spine and nerve system. This is day 23.